My name is Devin Wheeler. I'm a family medicine physician working with Genesis HealthCare system. One thing I'd like patients to know that when they come and see me is that I'm from the local area and I have a little bit more understanding of the way things work in more rural areas. I grew up living in the country. I've been growing up on a farm. So hopefully that allows me to connect with patients a little bit more and to hopefully understand where they're coming from. It's hard sometimes for patients. Their blood pressure is not always the most important or most pressing issue. They could have a lot of other things going on in their social life and personal life, and trying to have a better understanding of that helps to hopefully provide better care and to really treat patients better. In terms of having encounters with patients or seeing patients, I try to, for one, be as open as possible, right? So coming into the room, not having preconceptions about patients, and then also be open and try and actively listen to the concerns that they have and the questions that they have, and try to address as many of those concerns as possible. The other thing too, I think education was one of the most important things with patients. Oftentimes, patients don't understand exactly why we're recommending something or why something is important, and giving them the basics, the fundamental science background for why that's important to their health makes a big difference for them to accept that, and also to be their own advocate in terms of their health care. So everyone's on the same page and in terms of understanding the importance for things. We see every condition kind of imaginable. When a person comes in through the door, anything that is a concern to the patient, we'll see it. Now, oftentimes, or sometimes we aren't the specialist that is best equipped to treat that. So that's why we have a great team of cardiology, across the board, different specialists that we can send patients to. But that's why I like family medicine so much, and why I wanted to go into family medicine. We can be the first person that they come to, especially when you build a connection with patients and they can trust you. They might bring concerns to you that they've never brought to anybody else in the past, or maybe not even to their family. So again, that's why it's important to build connections with patients, so they do feel comfortable bringing up the skin change that they were concerned about that they haven't told anybody, or things like that. So that way, if we're not the ones that are best equipped to deal with it, we can get them to the right specialist that can. My favorite part of being a doctor is, having that human connection. So really being able to spend time with patients and to understand their story, and also with family medicine, we get to not only have that patient, or see one patient, but a lot of times the whole family, multiple generations, and we get to follow them over time. So we get to see the struggles and the positive things that happen in people's lives, and to really have a positive impact, or hopefully have a positive impact on people's lives throughout time. So I'm very family oriented. So growing up in local community, growing up with a fairly close family, that was always the best path for me. So especially going to medical school and working with some great family doctors and seeing the effect that they can have with patients, from basically birth to end of life, and kind of everywhere in between. It's and especially physicians that have been around for 25, 30 plus years. They've had patients that they saw as a child, and then they've had children of their own. So it's really great to see the progression that people have in their lives, and to be part of that, and to be privileged to be part of that, of people's journey.